Hello, welcome back. This is Dr. Raghav with your Onco Care Advisor. Follow us for more information on different cancers, what questions you should ask, and being your own advocate in your care. That's very important because information is half the battle. Knowing the right information in the right way. So today I want to talk about a new medication in breast cancer world that is actually making some good waves and offering more options for our patients. So in fact, someone reached out to me asking me some information about this. So I thought, why not talk about this? So what it comes down to is, if someone has metastatic breast cancer, one of the important tests now that we should do that we never did before is something called ESR1 mutation. It can be done on the tumor sample, preferably a recent biopsy. It may not be very accurate if we do this test on surgery that was done, let's say, several years ago. But who is the right person for having this tested and using the treatment that can block this mutation? So first, a typical person would be a stage 4 breast cancer person who has been on hormone treatment like anastrozole, letrozole, or fulvestrant, or exemestane. And the second part of it is someone who is progressing through the treatment. That means that treatment is not working anymore, cancer is growing. That's one kind of a scenario. The second kind of scenario is if someone is on, let's say, an endocrine treatment like letrozole or anastrozole in combination with a CDK4 inhibitor like ribociclib, abemaciclib, or palbociclib, and if they're now progressing on this combination. So these are the two possible scenarios where one could consider to check for ESR1 mutation. If ESR1 mutation is positive, that means these cancers can respond to a new set of drugs called elacestrant or imlunestrant. So these two are new medications that can target this ESR1 mutation that provide a longer disease-free interval or progression-free survival, meaning that it will prolong the targeted therapy options without needing chemotherapy as of yet. So these two drugs, while they're not available yet in India, but they're available through the National Patient Program. That means when your doctor prescribes it, you will be able to get that. I do not know the cost of this medicine in India, but it is FDA approved in the United States. So these two medicines are really helpful, but unless we check for ESR1 mutation, we don't have a way to know whether this new medicine will work or not. Again, I always close it in threes. The first step, there is a new medication, but we need to test something called ESR1, preferably on the most recent biopsy, and even liquid biopsy or the blood sample biopsies could be helpful as well, but ESR1 mutation. Second, elacestrant or imlunestrant are the two medications that can target this ESR1 and can be effective treatment option. Third point, when do we use this? After someone is failing the traditional hormonal therapies, or when the cancer is progressing on something like ribociclib with letrozole, then we could consider this. There is another topic on this as to if we should stop this treatment before we start the elacestrant, or we can combine that. I will address that in a different post, but I hope this is helpful. Please do not hesitate to reach out if you have any questions or if you have any situation that you want to talk about. Please DM us and I'll be happy to address that. Thank you very much for your time.